Vanakkam, good morning. In this video, we are going to discuss about the cardiac cycle. The cardiac cycle is the sequence of electrical and mechanical events occurring in heart during the single beat. Cardiac cycle is explained by the Vickers diagram. In the Vickers diagram, depict the aortic pressure curve. This is the aortic pressure curve and ventricular pressure curve. This is a ventricular pressure curve and atrial pressure curve. This is a atrial pressure curve and aortic blood flow and ventricular volume and jugular venous pulse. Phonocardiogram and electrocardiogram. Electrocardiogram. The Vickers diagram was first used by the Gall J. Vickers. It is very useful in the cardiovascular physiology. In the Vickers diagram, x-axis depicts the time, y-axis depicts the depend on the curve. In the pressure curve means it is we express in the millimeter mercury. In the aortic blood flow, it is liter per minute. In the ventricular volume, it is expressed in the ml. The cardiac cycle, it has the phases atrial systole and atrial diastole, ventricular systole and ventricular diastole. Atrial systole is the 0.1 second. Atrial diastole is not depicted in the Vickers diagram. It is merged with the ventricular systole and diastole. And ventricular systole is the 0.3 second. Ventricular diastole is the 0.5 seconds. Atrial systole duration is the 0.1 second. Atrial systole begins with the peak of the P wave, ends with the peak of the QRS commutes. The ventricular volume increases mildly. Atrial pressure increases due to the atrial contraction. So that produces the A wave in the jugular venous pulse. Atrial pressure exceeds the ventricular pressures. The blue color line is the atrial pressure. The green color line is the ventricular pressure. So atrial pressure is more than ventricular pressure. Fourth heart sound is produced in the phonocardiogram due to the inflowing of the blood from the atrium to ventricle through the atrioventricular wall. The atrial systole ends with the mitral valve closure. Atrial systole ends with the mitral valve closures. So atrial systole is important for the active filling of the ventricle. So 20% of the ventricular filling is contributed by the atrial systole. So 20% of the ventricular systole actively filled by the atrial systole. The remaining 80% of the ventricular filling is occurred passively during the ventricular diastole. But during the tachycardia and the exercise, ventricular diastole duration is decreases. So that time the atrial systole contribute more amount of the ventricular filling. So during the tachycardia and exercise, ventricular diastole duration is decreases. So ventricular filling occur passively is decreases. So that time atrial systole is contribute to fill the ventricle more amount. Atrial diastole duration is the 0.7 second. The atrial diastole occurs following the atrial systole, but the atrial diastole occurs during the ventricular systole. So, in the beginning of the ventricular systole, bulging of the atrioventricular valve into the atrium, it increases the atrial pressure. So, it produces the C wave in the JVP, C wave in the JVP. Venous return is increases. Venous return is increases. So that atrial volume also increases. That increases the atrial pressure. That increases the atrial pressure. Atrial pressures. That produces the V wave in the JVP. So due to total duration is 0.7 second. So atrial diastole occurs during ventricular systole. So we can see the C wave in the JVP due to the bulging of the atrioventricular valve to the atrium. The increases the atrial pressure due to the increases the venous return, the increases the atrial volume that produces the V wave in JVP. Isovolumetric contraction duration is the 0.05 seconds. So isovolumetric contraction is the initiation phase of the ventricular systole. So the isovolumetric contraction starts with the mitral valve closures, ends with the atrial valve opening. So total duration is the 0.05 seconds. During the isovolumetric phase, both the valves are closed state. Both the valves are closed state. So at the beginning of the isovolumetric contraction, the peak of the QRS complex is present. Peak of the QRS complex seen in the ECG. And first heart sound is produced in the phonocardiogram due to the closure of the mitral valve produces the first heart sound. And the ventricular pressure is sharply increases in spite of the valves, both the mitral valve and aortic valve closure. The ventricular pressure is increased abruptly from the 0 to 80 millimeter mercury in the left ventricle. In the right ventricle, it is 0 to 8 millimeter mercury in the right ventricle. So left ventricle 0 to 80 millimeter mercury. The right ventricle 0 to 8 millimeter mercury. The valves of the heart remain closed during this isovolumetric contraction phase. No change in the ventricular volume and aortic blood flow during this phase. No change in the ventricular volume and aortic blood flow. The isovolumetric contraction phase ends with the opening of the semilunar valve. That means opening of the aortic valves. So start with the mitral valve closure, ends with the opening of the aortic valve. The rapid ejection phase. The duration is 0.1 second. It is starting from this point to this point to this dotted lines. So ejection phase is rapid ejection phase and slow ejection phase. The rapid ejection phase is the 0.1 second. It starts with the opening of the aortic valve. Opening of the aortic valve. It increases the aortic blood flow. Aortic blood flow is steeply increases due to the opening of the aortic valve. So left ventricle eject the blood through the aorta. And steep fall in the ventricular wall. So most of the blood is ejected. So steep fall in the ventricular volume. So it is called as the rapid ejection phase. Ventricular pressure is increases. Ventricular pressure is increases. And aortic pressure also increases, but it is below the ventricular pressure. Aortic pressure also increases, but aortic pressure is less than the ventricular pressure. Atrial pressure falls in the early part and later it is slightly increases. Slightly increases. C wave is produced in the rapid ejection phase due to the pulsing of the atrioventricular valve into the atrium, right atrium. It produces the C wave in the JVP. The electrocardiogram ST segment is correspond to the rabbit ejection phase. These are the electromechanical changes occurring during the rabbit ejection phase. The reduced ejection phase duration is 0.15 second. The reduced ejection phase, ventricular and aortic pressure is decreases, but the aortic pressure is more than the ventricular pressure. Aortic blood flow is decreased, more amount decreased in this reduced ejection phase, greatly decreased in the reduced ejection phase. Ventricular volume is further decreased. Atrial pressure is increased slowly during this phase, atrial pressure, and T wave seen in this reduced ejection phase. T wave seen in this reduced ejection phase, and reduced ejection phases ends with the closure of the aortic valve. So ends with the closure of the aortic valve. So this is the reduced ejection phase is the longest duration in the ventricular systole, 0.15 seconds. Ventricular diastole is the filling of the ventricle by the blood flowing from the atria. So the total duration of the ventricular diastole is the 5 seconds. Ventricular systole is the 3 seconds. Ventricular diastole is the 5 seconds. It has the 5 phases: protodiastolic period, isovolumetric relaxation, rapid inflow, slow inflow, that is diastasis. The ventricular diastole ends with the atrial systole. The protodiastole is the transition period between the ventricular systole and ventricular diastole is the 0.04 seconds. So during this protodiastole, ventricle relaxes. Intraventricular pressure is less than the aortic pressure. Sublunar valves are closed, aortic valves are closed to prevent the backflow of the blood from the arteries into the ventricle. Closure of the sublunar valves produces the second heart sound during the protodiastolic period. Isovolumetric relaxation base duration is the 0.08 second. 0.08 seconds. The ventricular pressure falls steeply. Ventricular pressure falls steeply. No change in the ventricular volume. Ventricular volume, no change in the ventricular volume. Aortic blood flow is almost nil. Aortic blood flow is almost nil during the isovolumetric relaxation phase. Second heart sound is here during the early parts due to the closure of the aortic valve. Atrial pressure continue to rise during this isovolumetric relaxation phase. The peak of the V wave seen in the JVP. V wave seen in the isovolumetric relaxation phase, and it ends with the opening of the mitral valve. Isovolumetric relaxation phase ends with the opening of the mitral valve. Rapid filling phase duration is the 0.11 seconds. Rapid filling phases start when the ventricular pressure is less than the atrial pressure. It starts with the opening of the mitral valve. Peak of the V wave seen in the jugular venous pulse. The ventricular volume is increases due to the filling of the ventricle, but decreases the ventricular pressure and the atrial pressure. In the phonocardiogram, third heart sound is heard due to the flowing of the blood to the ventricle. That vibration produces the third heart sounds in the phonocardiogram. The diastasis duration is the 0.19 seconds. It is otherwise called as the slow filling phase. Ventricular filling occurs very slowly. So this is the slow filling phase. Slow rise in the ventricular volume. No change in the left atrial, left ventricular and aortic pressure. B wave is begins to appear at the end of this phase. Thank you for watching this video. If you like this video, press the like button and share your friends. Those who are not subscribed this channel, please subscribe. These videos briefly discuss the physiology topics. You must read the physiology textbooks. Thank you once again.